It's good to be here with you virtually. My name is Florence Baingana. I'm a psychiatrist and public health specialist. I'm the regional advisor, WHO regional advisor for mental health and substance abuse in the Africa region. I'm talking about African perspectives. I'm going to focus on the policy perspective, reflecting back on implementation science, and maybe talk about only 3 challenges. The first one is very fast. It is funding. Funding is always a big challenge when it comes to replicating, scaling up. The second challenge is that of people, policy, and process. If we're trying to replicate something, we always have to interact with people, and often in the context of conflict, having to deal with the policy aspects and the policy negotiation, and sometimes if it's an emergency, conflicts or complex emergencies, infectious agents, we're in a rush, we want to implement in a hurry, and yet we have to do the work that has to be done. And these two can be conflicting. They can be conflicting if you want buy-in, but at the same time you want the full engagement of the policymakers, then that may cause some delay. And the third one is that of where was the evidence generated? As an example, sometimes evidence is generated. We have a lot of conflicts here in the Africa region. We've had conflicts, we've had other complex emergencies, we've had Ebola. And as a result, a lot of the evidence is generated here in Africa. But if we say that we want to replicate it, let's say right now, if there was a need to replicate something where the evidence was generated in Africa, but it's to be replicated in the Ukraine as an example, what will be the uptake? Very often there's a feeling that something coming out of Africa, we have to do it for ourselves, and we're not going to take that. We want something where the evidence has been generated right here in our own country. And this is only an example. I'm not saying that it has happened. It's only an example. Many countries are like that. Even within countries, something where the evidence was generated in another region, or we would like to do something in one region where we have evidence from another region or another district or another province. Often they say we want to first confirm and have our own generation, our own evidence generated. So this can be a challenge. So you may have evidence for something that works, but you cannot replicate it for that reason. Thank you very much. These are 3 very brief issues I would raise. Thank you. Bye-bye.